just a reshoot. I don't want to do a quick video. I always want to do quick videos, but they always end up blurbing long because I blurb. It's about the difference between basically nursing students at the end of nursing school and RNs. It's obviously your license, but it's a matter of experience too, just on hands experience. So I've seen nursing students that are more comfortable than actual RNs. They've got it's just the license. It's like I said to my kids when they were getting their driver's licenses, and I sent them to driving school, whatever, paid a professional to teach them, because I could teach them how to drive, but I can't teach them how to get a license. That requires you following the rules, regulations, getting testing. I can teach you how to drive. I've been driving for, it's 35 years. But to get a license, forget it, you'll fail. Not the guy to teach how to get a driver's license. Not the guy to teach how to get a RN license. I could probably give you pointers on being a nurse. Most of the preceptors that I know and educators I know, even educators, can help you become a better nurse, become good nurses, become a qualified, experienced nurse. Could they teach you how to get your RN license? I would bet 99% of them would bow out of that. They would just absolutely say, no. You need a nursing professor. You need an actual nursing educator, not a nursing educator for the unit. That's a totally different animal. It's two different things. The chairperson of my program, actually, when I graduated, became an educator at my hospital. She gave up her position and gave up the position of chairperson of the program and opted to become a nurse educator in the hospital setting, because they're two different animals. The two different creatures. Getting your nursing license is getting your nursing license. Okay, now you can practice being a nurse. You can practice being a nurse. That's a phrase I'm choosing very carefully. All right? When you're in nursing school, you're learning to get your nursing license. You're not learning to become a nurse. They say that, but you're really learning to get your nursing license. Once you have your nursing license, just like when you get your driver's license, you're learning to drive after that. Once you get your nursing license, that's when you learn to become a nurse. What's the difference between nursing student and nurse? It's experience. That's it. Excuse me, got a little gas. It's how many times you've primed the pump, how many times you've given an injection, how many times you've prepared meds, how many times you've done wound care, how many times you've repositioned a patient, you've assessed, you've done your NIH scales, all that stuff. You charted all that. How many times you've given SBAR to providers, how many times you've given handoff to a fellow nurse. And that's where I did a recent video. Nursing school goes over SBARs like crazy. Great for providers. Yeah, that's great. What's more important? Handoffs to a nurse. That's much more important. Okay, I'll say that. I'll say it's much more important. Now, people will argue with me saying, hey, when you're talking to a provider, it's much more acute. Or that's like sometimes they're just calling for updates. And okay, it's not an emergent situation. Don't get me wrong. An emergent situation, yes, absolutely right. That's much more important than just giving handoff. But I'm talking about the 99% of the time when you're doing your job as an RN, handoffs are 99% of the time. I shouldn't jinx myself, but yeah, you're going to give important SBAR to a provider and so on and so forth to a transferring facility, getting SBAR, from a handoff from a nurse from ICU or ED, if you ever get a call from ED, ever get such a thing. But you hand off to your fellow shift nurses all the time. You're going to do it twice a shift. It's much more important. It's something you're really going to do. How many times are you going to give the TPA to clear a central line, whatever they call it? What do they call that? It's basically the same medication. It's just to clear the central line. There's a brand name, I forgot what it is. But how many times are you going to do that? Not very often. Is it critical? Hell yeah. But really? How many times are you going to give heparin shots? You're going to give them, you maybe give them 10 times a shift for all your patients, Q8s and blah, blah, blah. How many times are you going to give insulin shots, coverages, prandial, Atlantis, et cetera, et cetera. That stuff you're going to do. And you're going to get better at it as you do them more and more. And that's what I'm trying to get at with the video is, as a nursing student or new nurse, do that stuff. The more you do it, the more you're going to get comfortable, the quicker you're going to reach an experienced status. Especially now with the nursing shortage. And now when you are forced to prematurely become an experienced nurse, and I say this recently, it used to be a 2-year mark. It was a standard. It still is, in my opinion. It's just that we're being thrust upon that early. Mine was the actual COVID class. COVID hit right when we were graduating. We barely squeaked out of nursing school because they were ready to shut us down for clinicals. And I know a couple programs where they did. They had to actually do an extra semester. We were able to finagle our way and finish with enough clinical time to graduate. And then we were thrust right into COVID. Hey, so guess what? Now you're going to nurse during the plague. And we were doing stuff that it was like, what? We're working alongside. I remember working alongside 20-year, 30-year nurses that hadn't been on bedside. They're like, we haven't done this since nursing school. What? I'm a school nurse. I'm pressed into service. What? And here we are, grad nurses, being forced to do stuff that where it was like, what the heck? Because you had to. It was all hands on deck. It wasn't a question of patient safety. It was a question of patient safety. There was no one there. We had to be manning the walls, basically. So, was our learning curve accelerated? Yeah. Would I prefer to have another, year or 6 months, whatever, to really officially hit my 2-year mark before I'm thrust upon this stuff? Yeah, of course. I'd like to have that experience. That's why I went into a residency program. People say, why did you take the pay cut and go into a residency program when you could have just gone right into practice? Because I like to have the extra time. I want to be patient safe. I don't want to be patient stupid. I don't want to be patient unsafe. And I think everyone should go into a residency program, frankly. You can't hurt to have more training. If someone says, do you want more training? Yes, please. I'm first one. I just finished some extra training. They're like, we've seen you before. Why are you doing this again? Because I want to make sure my skills are up to snuff. I want to make sure they're up to snuff to the instructors teaching me. I went upstairs to my assistant manager to get some more clerical training. She was like, what are you doing here on your day off? I was like, I was doing some code training and I came up. Not to kiss her ass or anything, because frankly, whatever, I don't really care. I'm not here for the, position. I'm not here for promotions, but I want the training because I don't want to be a deer in headlights when shit hits the fan. That's more concerning to me. I don't want to, it's not a question of looking bad. It's a question of being caught unawares, because that's going to be a bad situation. I do not want to have to explain why a patient expired because I didn't know what the hell I was doing. That's not what I want to happen. It's not something you want to have happen either. You don't want to do that, So always accept more training. Always accept the practice, the clinical. It's an adage. I'm sure a lot of you nursing students here, if they ask for volunteers, volunteer. You cannot be smashed. You cannot be penalized because you didn't do it. This is a learning experience. Learn. And the more you learn, the better you're going to be. The more comfortable you're going to be. The faster you're going to get to a status and position and experience level where you're comfortable. Because in the end, you want to be a comfortable practicing nurse. You don't want to always be like, what the F am I doing, right? I already hit 10 minutes. Good luck. Okay, cutting it short. Bye.